Good day! I am Garcia, a second-year nursing student from Section 1 in Doc. So for today's video, I'm going to demo the sterile gowning and close gloving technique. So this procedure is the wearing of sterile gown necessary to safely carry out sterile procedures. For the assessment, we have to assess the availability of sterile supplies, the personnel if help is needed, as well as the location of sterile field to avoid contamination. Objectives: apply attire necessary to safely carry out sterile procedures. For the equipment, we have here a surgical mask, the surgical cup, sterile gloves, the sterile gown, and the Mayo stand or flat surface above the waist level. Before entering the delivery or operating room, always remember to wear your surgical mask and your surgical cap. Perform through surgical hand wash. This removes transient and resident bacteria from fingers, hands, and forearms. A circulating nurse to assist by opening sterile pack containing sterile gown. The gown's outer surface remains sterile. Pick up sterile gown below neck edge and lift it directly upward and step away from table. This provides wide margin of safety, avoiding contamination of gown or sterile field or table. Holding folded gown, locate armhole with both hands, grasp front of gown just below neck bend. Clean hands may touch inside of gown without contaminating outer surface. Allow gown to unfold. Avoid touching the inner portion of the gown with bare hands. Outside of gown will be sterile surface. With hands at shoulder level, slip both arms into armhole simultaneously. Ask circulating nurse to bring gown over shoulders by reaching inside to arm seams. Gown is pulled on, leaving sleeves cuffed, covering hands. Careful application prevents contamination, and gown sleeves cuffs covers hands to prepare for close gloving. And have circulating nurse to securely tie back of gown at the neck and waist. Gown must completely enclose underlying garments. With hands covered by cuff of gown sleeves, open the inner sterile glove package. Hands remain clean. Sterile gown cuff will touch sterile glove surface. With non-dominant hand inside gown cuff, pick up glove for dominant hand by grasping folded cuff. Sterile gown touches sterile glove. Extend dominant forearm with palm of glove against palm of dominant hand. Glove fingers will point toward elbow. Position glove for application over cuffed hand, keeping glove sterile. Grasp back of glove cuff edge with non-dominant hand and gown cuff. Dominant hand, thumb, and index finger holding on to edge of glove. Seal created by glove cuff over gown prevents exit of microorganisms over operative sterile field. Grasp top of glove and underlying gown sleeve with covered non-dominant hand. Carefully extend fingers into glove, being sure glove's cuff covers gown's cuff. Glove non-dominant hand in same manner. Reversing hands. Use glove dominant hand to pull on glove and keep hand inside sleeves. Sterile touches sterile. Be sure that fingers are fully extended into gloved fingers. This ensures that nurse has full dexterity while using gloved hand. Hand tied to sterile team members who stand still, allowing margin in safety. Turn around to the left, covering back tie from team member and secure tie to gown. Contact with team member could contaminate gown and gloves, and gown must enclose undergarments. For the evaluation, contamination is prevented and sterile attire is completely worn.